Crash course on aesthetic treatments so you don't get hustled by your med spa. Just kidding. Your provider should be an expert and recommend exactly what would be best for you. But we do love an informed consumer. So, starting off with the gateway drug neurotoxins. This is Dysport, Botox, Daxxify. There's a million of them by now. Basically all work the same. They work by temporarily relaxing muscles so that you cannot form certain wrinkles or make certain expressions. Another use of them is to atrophy a muscle. So if you have very big bulging masseters, like I did, you can inject them there. It just weakens them so that you can have a slimming effect. Neurotoxins last about 3 months for the average person. And hyaluronic acid fillers. This is filler. Different products are engineered to have different properties, different cross-linking, different firmness. So the hyaluronic acid filler that's chosen to go in your lips is not the same filler that's chosen to go in your cheeks because they're trying to emulate different tissue. Hyaluronic acid fillers are dissolvable with an enzyme called hyaluronidase. Fillers can last months to years. It depends on the person completely. So if your injector is telling you have to come back every 6 months, that is a very vast overgeneralization. Fillers should not migrate when placed properly, but that is a topic for a whole different video. Okay, the biostimulator category. Biostimulators are injectable. They are not the same thing as fillers. So fillers are meant to replace lost structure. Biostimulators are meant to replace lost collagen. Because it is stimulating your body to produce its own collagen, it is a gradual thing, but the results are incredible. These are over 2 years. These products are Sculptra and Hyperdilute Radius. They have a little bit of different properties and mechanism of actions, but they essentially do the same thing, induce your body to produce collagen. And you look just like yourself and you age backwards. Biostimulators are amazing. Still on the biostimulator wave, we have PRP, we have PRF, we have PDGF, we have PDRN, we have PRX. That's a lot of P's. So I made a chart to break it all down. PRP is platelet-rich plasma. It is extracted from when they spin your blood down and they extract that platelet-rich plasma. It is full of growth factors. PRP is seen as a little bit archaic in the aesthetics industry just because we have so much better technology now. PRF is platelet-rich fibrin. It has a more sustained release of those growth factors, so it lasts longer than PRP. Easy Gel is pretty interesting. It essentially makes a gel from your own blood and albumin, and that can be injected into the face and can give you a temporary filled look without putting hyaluronic acid filler into your face. And then in the meantime, because it is rich in those growth factors, it can also be biostimulatory. Now, PDGF, this is a typo. It is 300,000 times more potent. It's essentially like factory printed growth factors that you can then add, or you can microneedle with any of these. And then PDRN. PDRN is the salmon sperm. It is not approved for injection in America, but you can microneedle it into the face. It's basically segments of DNA and it's biostimulatory, so helping with collagen production, hydration, etc. And I also included PRX. It is a topical treatment that is a topical biostimulator. It's a TCA-based treatment, really little downtime, gorgeous glow. PRX is amazing. I put it in the P's because it starts with a P, but it's technically kind of more of like a facial. Okay, then there's other treatments that aren't injectable. So that's like microneedling, lasers, energy devices. Lasers get confusing because there's so many different brands and they're branded as their brand name, but they all essentially have the same technology behind them. For example, like we have the DECA and the Cool Peel, but essentially it's like, what does that even mean? It's a CO2 laser. At the end of the day, you're getting a CO2 laser with specific settings. I'm removing myself, so you can screenshot this if you really want to look into it and find which one is right for you. And beyond lasers, we also have light devices, so like the BBL, IPL. Those are good for like reds and browns, so like sunspots and that type of thing. There's also radio frequency microneedling, and then there's ultrasound devices for more of like a skin laxity and tightening, like SoftWave. But yeah, you can screenshot. If you're tackling anti-aging with solely aesthetic procedures, you really have the wrong mindset. There's so many other things to look into, whether that be hormonal status, inflammation status, cardiometabolic status, micronutrient status. Our practice focuses on both. Our providers have a background in functional medicine, so we really look at anti-aging from a holistic standpoint. Comment any questions.